Alrighty, good morning, everyone. Thank you very much for joining today on this wonderful uh, webinar that we're going to have to talk about managing stress with epilepsy. Who we have here today alongside with us, it's really my pleasure, really, in this case, to introduce Dr. Jada Santos, a clinical psychologist at Memorial Neuroscience Institute. Dr. Santos specializes in working with patients who are living with chronic disease, including multiple sclerosis, epilepsy, non-epileptic pseudo seizures, pain disorders, insomnia, mood and anxiety disorders, ALS, and other medical concerns. She also provides support to family caregivers, helping them navigate the challenges of caring for a loved one. With an evidence-based solution-based approach, Dr. Santos is dedicated to creating a safe and supportive space for her patients. She is passionate about understanding their stories and empowering them to overcome challenges. Please join me in welcoming Dr. Jada Santos.
Hello, everyone. Good morning. Happy Friday, Junior, as I like to call it. And thank you so much for having me here today. I wanted to talk today about how you can calm the storm and manage stress with epilepsy. All right. Next slide. The things that I'm going to go ahead and cover are what is epilepsy, along with its causes and triggers, the effects of epilepsy, care and support to calm the storm, and care and support for you. So let's start with what is epilepsy. Next slide. A neurological disorder marked by brief recurrent episodes of sensory disturbance, loss of consciousness, or convulsions associated with abnormal electrical activity in the brain. Epilepsy is the fourth most common neurological disorder, and it affects people of all ages. It's characterized by unpredictable seizures and can cause other health problems. Let's see here. They are brief episodes of involuntary movement that may involve a part of the body, which is partial, or the entire body, which is generalized. Having seizures and epilepsy can affect one's safety, their relationships, work, driving, and so much more. Next slide. Causes and triggers. So the specific cause is unknown for about half of all epileptic cases, but some conditions that can result in epilepsy are brain abnormalities, birth defects, developmental conditions, infections, deprivation of oxygen to the brain, strokes, or severe head injuries. Some of the common triggers include missed medication, environmental factors such as sleep deprivation, dehydration, extreme emotional stress, bright or flashing lights, loud noises, lifestyle factors such as drugs and alcohol, skipping meals, which can lead to low blood sugar, caffeine intake, menstrual cycle, and/or other hormonal changes, medical conditions such as infections like fever, flu, high blood pressure, or head injuries. Next slide, please. Effects of epilepsy can grow heavy, as we can see here, because of the global impact that it tends to have on people's lives. So let's go over what these are. Next slide. Functional activities, things like your physical functioning, your ability to perform activities of daily living, sleep disturbances, work and school, recreation, social consequences, things such as marital or family relationships, interpersonal relationships, intimacy, sexual activity, social isolation, psychological problems such as depression, anxiety, anger, loss of self-esteem, financial consequences, healthcare costs, disability, lost work, school days. All of these effects brew the perfect storm. Next slide. So let's talk about care and support to calm that storm. right? What does care and support for you or your loved ones look like? First of all, epilepsy is different for everyone, so the needs will also vary, right? But some areas that we can include that are important are medication management, safety, maintaining a healthy lifestyle, managing and addressing other health-related issues, as well as seeking or providing support. So let's go into a bit of detail for each of these. Next slide. Medication management. So you want to create a routine. You want to create a routine with the same time and place for medications. Set up a system, like placing them where you're going to see them and take them. Attach it to another activity you already do there. For instance, in the bathroom where you brush your teeth, right? You can have your medications there since you're going to see them when you go to brush your teeth, and then you can take them accordingly. You can use a pill box to help keep track of whether you took them that day or not, rather than keeping them in the pill bottles and then not knowing. Set up alarms. I like alarms better than reminders. Alarms don't shut off unless you shut it off. Whereas a reminder will go on your phone, but if you're not paying attention, you'll miss it, right? So an alarm will not shut off. You have to go to your phone and say, okay, stop or snooze, right? So I like alarms better than reminders. Use apps to remind you to take your medications. Always keep track of how many pills you have left, right? When you use a pill box, another benefit of a pill box, if you only have enough for that week, and there's maybe like 1 or 2 pills left or not enough for the next full week, then you know it's time to refill. That's it. That gives you enough time and leeway to contact your medical provider or contact your pharmacy and get your medication so that you don't have any missed doses. Certain medications can also worsen seizures, so understanding the need to maintain contact with your epilepsy specialist is super important, and we will talk about that for other reasons. Next slide. Medications that can worsen seizures. There are some common medications that can lower seizure threshold. Some antibiotics, certain antidepressants, specific antipsychotics, tramadol, also excess alcohol use or withdrawal from alcohol, benzodiazepine withdrawal such as Xanax, Ativan, illicit street drugs. Ultimately, again, the key is be sure to discuss your medications with your epilepsy specialist so that they can make sure that there are no contraindications to you. Next slide. Safety guidelines. There are some safety guidelines you want to keep in mind at all times, like you don't want to do certain activities alone, such as swimming, climbing anything, cooking over an open flame, giving a baby a bath. Don't drive if you've had a seizure within the past 6 months. Also, you want to know seizure first aid and what the specific steps are. So let's go over those. Number 1, keep the person safe by clearing the area of objects they could get hurt with. Move or guide the person away from harm onto the floor. What about it's you? If you happen to have auras, meaning you know a seizure is about to come on, we know that there's not a lot of time between the aura and the seizure onset, right? So it's not like you have time to sit there and let me look around. Where am I going to sit? Where am I going to place myself? No. So usually the advice that I give people is as soon as you get that aura, if you happen to get auras, immediately just sit on the floor. Sit on the floor. You're already to the lowest possible ground, so at least you don't fall, right? That's what you're looking for. Doesn't matter where you're at. Doesn't matter what's going on. Don't look around. Try and find a chair. We don't have time for that. You feel an aura. You get the aura sensation. Immediately sit down. Give yourself that safety piece, right? Number 2, turn the person on their side. Keep their airway clear by loosening any tight clothing around their neck. You may put something soft under their head. Don't put your hand, fingers, or anything in their mouth. And don't restrain or hold them down. Number 3, time the seizure. Look at the time when it starts and look at the time when it stops. You need to know that information. Check for a medical ID on the person, on their phone. If you don't know their person, stay with them, right? Call 911 if the seizure is longer than 5 minutes, if the person has difficulty breathing, if the person is injured, pregnant, or sick, if the person does not return to their usual state, if it is the first time seizure or it occurs in water, if the person is having repeated seizures, all right? Again, never restrain a person or hold them down, and do not put your hands, fingers, or anything inside of their mouth. Next slide. Maintaining a healthy lifestyle has a few components to consider. Of course, like I said, do not miss doses of your medication, get plenty of sleep, drink plenty of water, eat a healthy, balanced diet, and do not skip meals. Also, learning healthy coping skills to manage anxiety in the face of stressors is key. So let's talk about that. I know many people say, reduce your stress. But we don't have control of that. Stress is going to come whether we want it or whether we don't, right? And so what the key here is your response to stressors that come your way. Stressors are a normal part of life. They're not going to stop until your last breath on this planet. So it's not about, I need to reduce my stress, I need to stop my stress, I need to get away from stress. No, that's not what you're trying to do. You need to learn to manage yourself in the face of stress. Stress is going to come no matter what, right? So managing your response is key. As we see, the storm will come, right? But how you manage yourself in the face of that storm is ultimately the pivotal piece. Avoid alcohol, recreational drugs. Why? You can't think clearly, let alone act clearly, and do the things that you need for yourself, right? Flashing lights can be a trigger for some people with epilepsy. Try to avoid getting sick. Why? By using things like good basic hand hygiene. Use hand sanitizers, soap and water better. Avoid touching your face so that you're not spreading germs or illness to your eyes, nose, or mouth, right? Getting your annual flu shot is also a good preventative. Next slide. Managing and addressing other health-related issues. So, seizures could lead to other injuries or accidents, and that's why the seizure first aid is important, right? Staying with someone and being able to identify if any other injuries have occurred as a result of the seizure to report to the healthcare team. Also, some side effects of seizure medication can affect thinking, can affect mood, can affect bone health, or other systems. So, make sure to address all concerns with your healthcare team. This is important. You see that I've already highlighted that 3 times. Other conditions associated with epilepsy can cause more problems than seizures. So like I said, keeping on top of everything, and don't associate everything to your seizures. Oh, it's because I have seizures. Oh, it's because I have seizures. Oh, it's because I have seizures. You cannot dismiss these concerns. This causes other issues. So you want to make sure you address everything. Next slide. Here's the reason we just went over that. How healthy are those living with epilepsy? The Centers of Disease Control and Prevention, as well as other researchers, have found some startling information regarding the health of those living with epilepsy. Adults are more likely to have unhealthy behaviors, such as smoking, being less active, sleeping less than people with epilepsy. They're more likely to have other chronic health problems, as well as report poorer health, more likely to report problems affecting their mood and emotional health, thinking or cognition, and their ability to work. Also, they're more likely to report unhealthy days if they had 1 or more seizures in the past 3 months. Getting or keeping healthy is part of self-management or taking care of yourself. Next slide. Some common mental health problems: low mood or sadness, feeling isolated, disconnected, low self-esteem or confidence, lack of motivation, burnout, stress, anxiety, difficulty sleeping, irritability, anger, emotional outbursts, difficulty staying focused, concentrating, difficulty completing or starting tasks. These are all common mental health problems. Next slide. So seek support. As I previously stated, this will look different for everyone, but communication is key. Be specific in asking for what you need. Also, when people offer, accept. Don't sit there and say, yeah, but, or okay, maybe. Accept. Doesn't matter what it is. Doesn't matter if it's something that you can do on your own. Doesn't matter. One less thing is one less thing, right? It's one less thing on that scale. Doesn't matter what it is. If they're willing to give support, take it, whatever it is, okay? Have someone join you during leisure activities or note any patterns or triggers to your seizures. Go to appointments with you, take notes, provide descriptions of the seizures, act as a representative or advocate for you, provide transportation for you, stay with you, or see you home safely after a seizure. Right? These are all ways in which someone can support you. Next slide. What about care and support for you? This is where people tell me, isn't that selfish? So first, let's understand that self-care is not selfish. Selfish is me first. Self-care is me too, right? You also deserve to take care of yourself and your well-being on all levels, right? Next slide. So let's talk about some myths of self-care. Self-care is an indulgence. Actually, meaningful self-care includes making mindful changes in patterns of thought and behavior that do not contribute to your well-being. What about self-care is selfish? Well, when you make time for yourself and you get sufficient rest and exercise, you feel more energetic and you'll be able to do more for yourself as well as for those around you. Self-care is a one-time experience. Looking after yourself is an ongoing practice in building resilience to face hardships and in preventing burnout. Self-care is time-consuming. I don't have time for that. Self-care does not require you to take out a huge chunk of time from your busy day. That is definitely a myth. Next slide. So what can self-care look like? It can look like asking for help. It can look like having alone time, putting your needs on the priority list and not taking it off, asking for what you need, setting and maintaining boundaries, staying at home, saying no. That in and of itself is a complete sentence. Forgiving yourself, being nice to yourself, taking a step back. Next slide. Steps towards good mental health. Let's go with food, drinks, and drugs. Nutritional health. You want a brain healthy diet that includes plenty of water, fruits, vegetables, proteins, right? I don't need to give you an actual diet. Everybody knows what's good for you and what's not good for you. The problem here is being mindful of the choices, right? Making sure that you are including the things that your body actually needs. Which are those things? Avoid drugs, alcohol, cigarettes. Reduce stimulant use, coffee, tea, soft drinks, chocolate, energy drinks, right? Physical health. Daily exercise. This is more than just for weight loss that I'm talking about here or for maintenance purposes. 30 minutes a day for brain health. Every day, including weekends, holidays, crisis, stress. I don't care what's going on. 30 minutes every single day. Does it all have to be at the same time? No. You can break it up. It can be 3 10-minute sessions, 2 15-minute sessions. Do what you need to do, but you need this for brain health every day. Sleep quality. Quality sleep. Making sure no electronics 1 hour before bed. No phone, no iPad, no TV, none of that before bed. Why? Phones in bed at night until late hours. Sleeping with your phone so close that you hear all the little dings and pings of things happening. That disrupts your sleep. It's not helpful, not necessary. Emotional health, positive coping skills to manage your emotions effectively, setting and maintaining boundaries, creating and sticking to routines, managing your stress effectively. Here's a good one. Managing expectations, right? Workloads and timelines. We always seem to think, I have time for that. I can do all of this in this time frame. But can we really? Manage your own expectations. We have this fear of not getting it all done, and then it cuts into what should be work time versus non-work time, right? Manage those expectations for yourself. Spiritual health. This is having a sense of meaning, having a sense of purpose, having a sense of hope, right? Environmental health. Who's around you? What's the area you tend to be in? What does the ambiance feel like? Is it supportive? Is it toxic? What are you taking in terms of different types of diet, not just food? What about social media, news, magazines, song lyrics, podcasts, books that you're reading? Is it positive or is it negative, right? Being outside more, sunlight therapy, right? Mental health, meditation. Ooh, that's a big one, meditation. You know, it's interesting to me, people don't take mindfulness and mental relaxation practices seriously enough. They still have this woo-woo thought process behind it, right? There's already scientific evidence of the benefits of it, right? And so practicing, they use it so much so that they use it in sports, they use it in training. You can do the same thing for your brain. It's necessary. Get into a practice. Diaphragmatic breathing. When we work all day without breaks, that harms our brain. That harms both mental and physical health, right? When we're sitting behind these computers 8 hours a day, that's horrible for us. Horrible, right? People say, I don't have a minute. I don't have time to take a break. But then everything takes longer to do. Everything takes longer to complete. Why? Because you didn't take a minute to kind of just clear your mind so you can start clear. I like to use the analogy of we have beautiful waters here, right? The ocean. You can see nice and clear to the bottom. You can see the sand. Beautiful. You walk in the water, you shift the sand. Starts to create a murkiness. You can't see clearly anymore. You have to wait till the sand all settles before it's clear again. Same thing that happens with our brain. You have so much going on, it's too murky for you to think or behave clearly. You have to wait to settle down. That's what those breaks are for. Before you can think and see clearly again. And be kind and compassionate to yourself rather than critical and judgmental or just plain mean. We tend to be really mean to ourselves, right? So as I said previously, forgiving yourself. Social health, connecting with others, helping and giving to others, sharing, bonding, quality time, affection, right? That's why so many people, in the pandemic, being alone, that was a huge thing. That's why pets are helpful, right? They have that ability to help us be connected, bonded, affectionate, right? Next slide. Ultimately, you want to understand that no one can do this alone. Actively, you want to manage your stress by taking time to exercise, meditate, talk to a friend. Finding positive, healthy ways to manage your stress can lower the risk of negative health consequences. Live one day at a time. Cope with things as they come. You're going to have to deal with it when it comes anyways. You're sitting there trying to think about, well, what if this? And what if that? And what if this? When it comes, you're going to have to figure it out. Why are you wasting mental energy and time that likely is not going to be the answer you're going to need anyways? You're still going to have to figure it out when it happens. Don't do that. Stay in the moment. Something that meditation is helpful at keeping you focused at doing. Seek support from family, friends, support groups, social groups. churches, whatever you need, right? For many, this could be enough. This support could be enough. But if you find yourself overwhelmed, a psychologist may be able to help you. Next slide. Let's talk about when to get help. If you find yourself feeling persistently sad or anxious, plagued with physical complaints, unable to sleep, irritable, feeling hopeless, unable to face routine chores for more than 2 weeks, talk to your doctor or mental health professional. Next slide. So just a few benefits that therapy can give you include less anxiety, greater self-confidence, better relationships, regaining emotional balance for yourself, increased assertiveness, stress relief, ability to set boundaries, trauma resolution, someone to talk to, someone objective to talk to that's not in your circle. There are so many things that people don't understand. Most of the time when a doctor says, maybe you should see a psychologist, the first thing everyone says is, I'm not crazy. I don't need that. It's not about that. It's about we live in an overscheduled society and everything is go, 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 go. We don't give ourselves breaks. We are not kind to ourselves. We have not been taught the skills that we need to be able to manage ourselves appropriately. That's what therapy is for. It's not because you're crazy. It's because you're stressed and overwhelmed and you need the skills and the tools, and we can help with that. Next slide. So with that, I want to say thank you for having me here today. Next slide. And please remember that mental health is just as important as physical health. Stand up to the stigma and talk about mental health. Thank you.
Alrighty. So I just want to say once again, thank you to Dr. Jada Santos for being able to present today this wonderful, very informative topic. By all means, if anyone has any questions, please feel free to share.
There are a couple of questions in the chat box. I don't know if you see them. One from Angela.
Yes, I see it. What is the difference between a psychologist and a psychiatrist? So, initially in the field, there was no difference. Currently in the field, the difference is that a psychologist does not prescribe medication and a psychiatrist does. So the psychiatrist will see you, 15, 20 minutes, if that, figure out what the medication needs are, what the adjustments need to be, take care of that. Psychologist is going to sit and talk with you for a good 45 minutes. Somebody else also put there, my daughter's aura can last a long period prior to a seizure. That's great. That gives your daughter time to set herself in a position so that she won't hurt herself. That's great. A lot of people do not have a long time. They'll get an immediate sensation and immediately the seizure comes on. So that's actually a benefit to your daughter. What antibiotics can be bad for seizures? There's different ones. It depends. And that's why I say keep in contact with your epilepsy specialist, because they'll be able to let you know what are the differences and the ones that would affect you.
So one question that we have here is why is caffeine bad for people with epilepsy?
So caffeine, what does caffeine do for us, right? Why do we usually take caffeine? We take caffeine because we want the stimulant. That's the aspect that we want from it. Well, that also creates a stress response in us. So if we're not well at managing ourselves, that can trigger. So again, our overscheduled society, we tend to have a very bad cycle. We'll sit there and use different stimulants like caffeine, coffee, sodas, sugar, chocolate, to kind of keep us going throughout the day. And then, of course, it's going to affect our sleep cycle at night. And it just gives us a very vicious cycle. All of these things are then affecting epilepsy. Why? Because you have poor sleep. That's not good for you. that high stimulant drive, not good for you. All of these things trigger more seizures, right? You need to be able to manage yourself. Manage yourself, you do that diaphragmatic breathing, you focus on meditation, you do outside therapy, sunlight therapy, it's different things, but you need to be able to manage you, right? Using outside things like that are just going to heighten your system is not going to be helpful for you. I hope that's helpful. Since epileptics can't remember well, could we have this meeting again? I think they said that it's going to be recorded, or it is recorded, or was recorded. So you'll be able to see it as many times as you need to see it.
We have another question. Sorry. Are sleeping issues known amongst all epileptics or only most?
That's dependent. There's no such thing as all, right? It's dependent. It just happens to be something that is correlated with them. So it's likely a most, not an all. If you've tried BNS and RNS and been on almost every seizure med, but still having seizures from both sides of the brain, any suggestions of what to do? Again, remember, epilepsy is a condition that you live with. It's not something that is likely to go away completely forever, right? And so it's learning more so how to manage that storm, how to manage yourself in that storm. The storm is there. The storm is not going away. You may have periods where you don't have them as often. You may have periods where you don't have them. There's going to be periods where you have them often. It's about learning to manage yourself, learning to manage your lifestyle so that you are in a better position preventatively, right? When they come, how often they come, you don't have control of. You have control of all these other factors. So make sure you focus on those.
So one question is, there are all these walks and get-togethers, but can drive. How would you be proactive in that case?
That's where I said earlier, you want to be able to, whether it's disability, right, and you get some kind of benefit with the insurance, either with TOPS service or something like that, whether it be friends or support groups or family that you create community with that can help with the driving. That would be another piece. And of course, lastly, our poor, it's not great, our poor transportation system here.
And then it's not really a question, but again, just a reminder, right? So someone stated there's an in-person support group in Fort Lauderdale, second Tuesday of every month, right? So it's an example just of one of our support groups. Our main, not our main, but most of our support groups are virtual, right? We do have in-person options, but most of them are virtual. So, if it's really hard to get somewhere, by all means, you can just put it on your phone, on your laptop, or your tablet, and it definitely you can meet through there as well. But definitely, yeah, making sure that we're part of communities of groups that we feel comfortable with, and that they feel comfortable with us. It's, I think, something that's important in that sense, right? Especially when we're trying to at least here in the organization create that community, right, and create that kind of family bond that we so much stress for in that sense. Okay, let me see any other questions in the chats. Okay, I'm gonna give it in that case a little bit, just one extra minute. One more question that I see here, and I believe this will be one of the last ones. It says, "Foods that buffer, quote unquote, buffer, means what? Good or bad?"
That means, like I said, making sure that you're eating things that your body actually needs. You're having adequate water intake. You're doing fruits. You're doing vegetables. You're doing protein, right? These are the things that your body actually needs. Do we need fried food? No, we don't need fried food, right? Do we need all this processed food? No, we don't need that. We choose to have that because we want to. That's not what your body needs. The buffer is when you have adequate nutrients to your body, those are the nutrients that your body needs. That's the buffer. right? You're getting the adequate supplement that your body needs, right? The fruits, the vegetables, proteins, the specific carbs that your body needs, all of those things. It's just like when you buy a car, right? When you buy a car, they tell you the specific kind of gas that you want to put in it. Some cars need a higher level of gas, some needs a middle level of gas, some need the regular level of gas. But you can't put diesel in it if what it requires is gas, right? One is going to be helpful, one is not, right? So, and you see, Huey started giving me seizures, so I had to stop. Listen to your body. I will always be an advocate of that. Listen to your body because everybody is different. Listen to your body. Your body will tell you what works for you and what doesn't work for you. So yes, if Huey started giving you seizures, no more Huey. You know?
Not a question, and Ms. Kiss says thank you for all your patience. No, thank you for asking all your questions and being so interactive. Obviously, you know that's exactly what we're here for. That's exactly what Dr. Santos is here for as well. I mean, you know, this time that she's able to provide to us and to you guys, and obviously more than anyone, it's exactly to answer any doubts, talk about this important topic, and be of service for everyone here. So no worries about a official now. That's exactly what we're here for. No.
Agreed.
Let me see if anyone else has any little other questions.
All right. Thank you, everyone, for having me here. I appreciate it, and I hope I was helpful. And like they have it's going to be recorded, so you can come back and see it at any time. All right. And I think they put my information on there if you need that as well. Thank you so much.
Thank you guys, and thank you, Dr. Strong. Thank you very much. Appreciate you.
Bye-bye.